This conference will now be recorded.
We are starting our recording, and I'm also going to be muting it after we finish our introductions. So if you have any questions, if you're able to type them in the chat box, you can do that. Or at the end of our presentation, we'll open it up for any questions that you have. So once again, I want to thank everybody for joining our call today. And we will be, is this how?
Do the right side.
Sorry.
Over here. Just click over here.
Oh, over here. Okay. Okay, so here's our agenda today. We are going to be talking about some great updates that we have for you regarding the Medicaid expansion in North Dakota with the Sanford Health Plan. We also have two guest presenters joining us today from the Yankton Sioux Tribe and Spirit Lake Nation. And we will have Chad Radigan, Program Manager for our program, providing some GPR updates for our participants. And we'll go over our March CRC March Awareness Month, and we'll be talking about some tribal proclamations, our media blitz, our Show Your Blue campaign, and we'll also be having a guest presenter that month too with Dr. Drago Brooks from the American Cancer Society. So we're really happy about that. And then we'll close it off with questions and open discussion, and we'll also be providing some updates for our program partners. So once again, I'm Gina Johnson, Patient Navigator, and the region that I focus on is our tribal communities within South Dakota. Our program director is Tinka Duran. She's a member of the Rosebud Sioux Tribe. Our program manager is Chad Radigan. He's a member of the Cheyenne River Sioux Tribe, and Eugene Gallego, he's also a member of the Oglala Lakota tribe as I am. And our other navigator, Devereaux Yellow Earring, he is a member of the Cheyenne River Sioux Tribe. And unfortunately, Devereaux isn't able to join us today. He is in Alaska at a core concepts training. So he is over there on we will go ahead and open up the floor to all of you who are on the call with us today to go ahead and introduce yourselves.
Okay, I'll start. My name is Nancy Velasquez. I'm the CHR manager, case manager with the Ponca tribe based out of Omaha.
Good morning.
Good morning. This is Marilyn Yellowbird with Elbow Woods Memorial Healthcare Center. I'm here with Lila Wells and Robin Free, who are helping with our coordinate our flu fit programs, and from Newtown, North Dakota. Good morning.
Good morning.
Good morning. Good morning, Jackie Arpan from Rapid City. I also have Cheryl Castillo here, our volunteer.
Good morning. This is Georgia Arts from Belcourt, and I believe Christina Morin is also on the call.
Hi, this is Jody Fetch from Custer Health out of Mandan, North Dakota.
Morning, Richard Sully, Yankton Tribe, and I bet Devereaux's already telling stories.
Oh, you know it. He's quite the entertainer.
Good morning, everyone. This is Stella C1 Zimmerman, the external evaluator over at Great Plains Tribal Chairman's Helpline.
And good morning, I'm Suzanne Mueller, and I work for the Ponca Tribe of Nebraska out of Lincoln location.
Good morning, this is Sandy Anderson with Winnebago Public Health Nursing and Winnebago Tribal Health.
Hi, this is Gypsy Wana with Assist in Wapanoyate.
Good morning, I'm Chantal Dubois. I'm the health educator here at Spirit Lake Tribe.
Good morning, this is Micah Tibbs from the Cheyenne River Sioux Tribal Health. I'm the Director of Nursing.
This is Jessica Tweeton. I'm a public health nurse at Spirit Lake Tribal Health.
Good morning, I'm Juanita Chasky from Spirit Lake CHR program.
All right, I see a few more callers on the line. Do you want to go ahead and introduce yourself? I see Shannon, Simone, Stacy.
Hi, this is Stacy Burnett. I'm with the American Cancer Society and I'm based in South Dakota.
Hi, this is
morning,
Shannon Baker.
everyone.
This is
Hi,
Jolene Keplin. This is Jolene Keplin with Health Education.
Hi, this is Shannon Bacon with American Cancer Society based in North Dakota.
Good morning, this is Simone Bordeaux with the Rosebud Sioux Tribe Health Administration.
Hi, this is Lillian Orm with the University of Utah.
All right, is that everybody on the call today? The webinar?
I think so.
All right, well, thank you all for introducing yourselves. I'm gonna go ahead and mute the background and we'll begin our presentation for you. And at the end, we'll open it up for questions. And then when our guest presenters are done too, we'll go ahead and open the floor up for questions when if you have any for them. Okay. So once again, thank you all for introducing yourselves. And with that, we're going to start our presentation and we'll begin with touching base about Medicaid, which provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by states according to federal requirements. The program is funded jointly by states and the federal government. Medicaid is a health coverage program operated by states and within broad federal guidelines. And although the federal government pays for a portion of the cost, Medicaid is administered and operated by the states. And each state's program can be a little different depending on the needs and goals of that state. Once an individual is determined eligible for Medicaid coverage, it is effective either on the date of application or on the first day of the month of the application. Benefits may also be covered retroactively for up to 3 months prior to the month of application, if the individual would have been eligible during that period had he or she applied. Coverage generally stops at the end of the month in which a person no longer meets requirements of eligibility for Medicaid. The Affordable Care Act, also known as Obamacare, in 2010 was created for the opportunity for states to expand Medicaid to cover nearly all low-income Americans under the age of 65. Eligibility for children was extended to at least 133% of the federal poverty line in every state. Most states cover children to higher income levels, and states are also given the option to extend eligibility to adults with income or at or below 133% of the federal poverty line. Majority of states have chosen to expand their coverage to adults, and those that have not yet expanded may choose to do so at any time. Unfortunately, South Dakota does not have Medicaid expansion because they haven't yet accepted federal funding to expand its Medicaid program. So eligibility rules in the state remain the same as they were prior to the Affordable Care Act. The governor has supported the Medicaid expansion, but it hasn't been pushed by law, and the lawmakers aren't supporting it at this time. We also learned that Nebraska did vote to expand Medicaid in their state, which is a ballot in Nebraska on their November 6th voting, and they approved it, and Medicaid is available for people who are under the age of 65 and with incomes that are equal or below the 138% poverty level. In 2018, this amounted to an annual income of $16,753 for an individual and up to $34,638 for a household of 4. This initiative required the Nebraska Department of Health and Human Services to file a state expansion plan with the Federal Centers for Medicare and Medicaid Services on or before April 1st of 2019. The state of Iowa, home to Sac and Fox Tribe of Mississippi, has also expanded Medicaid. Iowa's Medicaid covers beneficiaries at higher incomes than other states do. And Iowa expanded their Medicaid to low-income adults through the Affordable Care Act. At 26% of the Iowa population is low income. So that's really great because a lot of people are able to have access to whatever services that are available through their Medicaid expansion. With that, I'd like to discuss the great opportunities that are available for residents in North Dakota. I did invite Sanford Health Plan Care Management Director Barbara Vandensler to share information and resources regarding the Sanford Health Plan, but she's a very busy lady and she wasn't able to share with our task force today. But we're happy to share some great news, and there are resources available for patients who are in need of assistance for transportation, meals, and lodging. And to qualify for those resources, you must be, of course, enrolled in the Medicaid expansion. And what that entails, if you cannot get a ride from any family members or friends, the Sanford Health Plan can help you to take you to and from your medical appointments. They can also help you to pick up your medications from the pharmacy. Rules for transportation assistance include members of any age. Appointment must be for a covered medical service or for going to the pharmacy to get your prescriptions after an appointment. All travel and medical visits must be approved ahead of time before travel is arranged. Travel is for routine, non-emergency medical appointments, and you must be unable to find another ride to get to your appointment. Meals will only be pre-approved when a medical appointment and travel requires you to stay overnight or past 10 p.m. Each day you have a set budget to spend on your meals, and any cost above that amount is on the patient. So that would be their responsibility. For lodging, the Sanford Health Plan can arrange for pre-approved stays when a medical appointment may require you to stay overnight. When calling the transportation coordinator, you need to inform them that of your expected check-in and your checkout, and any special needs that you may have, like if you need wheelchair assistance with that, and if you have a service animal. If you choose to stay longer or have other charges like movies billed to your stay, the patient is responsible for those bills. Things that are not covered include transportation and meals and lodging for like routine dental appointments. So it sounds like it's a really great opportunity available for patients who are in need of those services. So we're really happy to share that with you. If you have any more questions about that, you can always visit Sanford Health Plan on their website. And if you need to enroll for Medicaid too, there's online resources there available that can direct you where to apply for those benefits. With that, we're gonna go into colorectal cancer, some education on that. Of course, we all know that it's one of the most common forms of cancer. But by providing education and screening about colorectal cancer, we can detect it earlier. And through routine screenings, colorectal cancer is preventable, it's treatable, and beatable. Health fairs and screening events are a common health promotion strategy used in communities to disseminate information about screening and other pertinent health information. Providing the education and screening at health fairs can change and increase an individual's awareness about CRC and how to screen for it, their options for that. And with that being said, we're going to be introducing our partners at the Yankton Sioux Tribe and Spirit Lake Nation. Our first presenter will be Jessica Tweeten, and she is a registered nurse at the Spirit Lake Nation Service Unit located in Fort Totten, North Dakota. And Sherry Schaefer, she is also a registered nurse and also has a Bachelor of Science in Nursing. She is the Director of Public Health Nursing at the Spirit Lake Service Unit, and she oversees the colorectal cancer screening project there. Our second presenter, Richard Sully, he's an enrolled member of the Yankton Sioux tribe, and he's the health educator for that community. And he's a trusted member there, and he collaborates closely with the Wagner Indian Health Service Unit. So with that being said, I'm going to go ahead and switch the presentation over to Jessica Tweeten. And I need to take off mute.
You can just find her.
Can you hear us?
Yep. Oh, sorry, Jessica. Let me just make sure I'm doing this correctly on our portion of the screen here.
She's good.
Okay. All right. So we'll go ahead and turn the slides as you need.
Okay, thank you. So yeah, we have quite a few of us in the room here. Myself, Jessica, Sherry Schaefer, and we have Juanita Chasky with the CHR program, and Chantel Dubois with health education. So we'll kind of all chime in and, I don't know, get through this presentation together. You can switch the slide. I don't know if I can do it, but. Oh, there you go. Did I do that?
Did you do that, Deanna?
Or not?
Or just?
I don't know.
Okay.
Okay, so this is our second year as grant participants with the CRC screening, and our goals pretty much stayed the same from last year's to this year, with wanting to increase the number of people that receive the screening kit, providing education about the screening kits at 2 events throughout the year, and then targeting people individually as well, with public health nurses going into the home as well as the CHRs. Let's see. Next. Okay, so these are some pictures from last year's Colorectal Cancer Awareness Month event, which happened in March. We brought in the smaller roll-in colon for some visual education. We handed out fit kits and t-shirts with our slogan, "Give colon cancer the boot." And our photo actually on the bottom left won second place in a photo contest that you guys put on, so that was exciting.
Yes. And it was fun taking the photos.
Okay, so here is this year we did our second annual cancer awareness event, which we held in October. Tribal Health does a lot of events throughout the year, but we've kind of dedicated October to cancer awareness. And this was just another good opportunity where we could bring some more education and awareness around colorectal cancer screening. So we had many booths, many educational booths about different types of cancer. We had guest speakers, stories told by survivors, and then that was a big enough event where we got to actually have the large roll-in colon brought in, and we've got some pictures on the next slide of that. So there it is, huge rolling colon. Thanks to Chad and Eugene for coming. They brought a nice spread of educational handouts. They helped out a lot with pre and post quizzes. We provided step-by-step instructions for patients who are 50 and older so that they could participate with the fit kit collection and try to increase some of our numbers that way with screening. So to help us stay organized, I think this is one of the things we learned like throughout the trial of the first grant year to this year was we really needed to keep track of our screening kits that we gave out. We wanted to make sure we were targeting the appropriate people, age 50 and older, and then we made some exceptions to if they had a family history of colon cancer or they were exhibiting any symptoms. So we'd have them sign up on this roster here, keeping track of the kit and kind of following it through the process. If they don't return it, trying to reach out to them, finding out if they're going to collect it, bring it back, and just track them through the process a little bit. And then we did have some gas cards available too, thanks to the grant. If they returned their kit, we were able to give them $50 in gas cards, and that just assisted too with getting to and from appointments. If they were going to have a follow-up colonoscopy, that would help eliminate that travel barrier a little bit too for our patients.
We also had, this is Sherry, what we did was the very initial, when we first started this last year, we kind of had a bottleneck at lab because people were bringing their samples into lab. So that was one of the wrinkles that we tried to iron out. So what we did, working with the lab folks and the Spirit Lake Health Center, the clinical director, we had made the arrangement that they would bring the kit back to the public health nurses, and then we would gather that, and then we would take it directly over to lab. So we would put the orders in and follow that through, and then take the kits back over. That way there was not that bottleneck at lab, and then we were tracking it with this tool that Jessica and myself continued to upgrade or update.
Yeah.
And I think it's working pretty good now.
Yep.
So I just want to add that.
Yes. Okay, so here's just a picture of our fit kit, what we give out during these events to patients. And we try to have it spread out on the table too with really easy to read pictured instructions for the patients so we can explain it to them first in person, step by step, and then send them home with that easy to read pictured instructions to look at a later time too if they need again. So that's everything that we include. The collection hat, pair of gloves, the collection bottle, the specimen pouch, and the mailing envelope. And even though they don't mail it, these are just extra ways that we can make sure they have everything labeled correctly with their name, birth date, and the date that they collected the sample. Makes it easier for lab as well.
Yep. And we found out you want to make sure these instructions are really, really very
clear.
simple. Because even you can make them as simple as possible, and they still can not quite understand. So we had a little bit learning curve with that too, right, Jessica?
Yes, yes.
Yeah.
And then on the next slide, this is just the picture of our instructions. How we tried to simplify it as best we could for patients to understand and do the sample correctly the first time. So that's been a helpful addition.
You should give an example of that.
Okay, so just to kind of try to mimic the flu fit, which some people have done, and we hand out the fit kit separately. So any opportunity for prevention, we try to combine as many things as we can. So we also offered flu shots at our colorectal cancer screening event.
Yep.
Other than that, that's it. Any questions?
Does anybody have any questions?
Joey came on. Joey Delapaz is working closely with us too from the Spirit Lake Health Center. He's like the CAC person at Spirit Lake Health Center, and he helps us with the reports and numbers and just working together with us. So we continue to try to improve our processes and also the screening process at the clinic. We're trying to work together with them too.
Yeah,
so we thank. So this is Sherry. So I want to just partnership is really
key to making this thing run smoothly.
So I want to thank Joey Delapaz and Jessica and Juanita
and our Great Plains guys, Chad and Eugene, for coming up anytime we need them for an event.
And working together and partnering. And Chantel, because she helps a lot as our education person. She's always right there to help us with anything that we need. So, which includes like a monthly, like a newsletter. And so she puts this information out in that too. And then those are sent out, I think she delivers them to Meals on Wheels, and then that goes out to 200 elders on the Spirit Lake Nation. Do you guys have any, do you want to add anything, Chantel or Juanita? And CHR works closely with us too.
So I got a question, Jessica and Sherry. So just to summarize what you guys are saying, to have a successful food event, you recommend doing being organized, having good partnerships, and communicating appropriately, correct?
Yes, definitely.
Perfect. All right, thank you.
Thank you.
Thank you.
All right, thank you for your presentation, ladies. We greatly appreciate it and value all your work and efforts to making this project a success. So thank you and kudos to your team. And we're going to go ahead and turn it over to Richard Sully with the Yankton Sioux Tribe.
Hey, man.
Oh, yep, we can hear you.
Hey, yeah, good morning.
Good morning.
A lot of the information, that I'll share this morning, that has been, some successes and some challenges, for, our colorectal cancer, screening grant is, it's, like I said, I have some success and challenges, but a lot of it has to kind of, maybe like mirror, just like the last presentation is, well, for starters, this is our third year, that, our tribe, and our office is facilitating, the GPCCSI grant. And you know what, it has been, really beneficial because, it just, just get the information out to get people, the education to get screened. And so it has been, like a good resource for us. So I wanted to start out by saying that. And like last year, we did have two colorectal cancer screening events, and I know we make sure we get those out, whether it's in hanging up flyers here in our local newspapers, our tribal newsletter, and I too also want to say thank you to Gina and Devereaux for this being there. And if you want to plan an event, they're always willing to plan around, make sure you guys have a date that works. They're willing to send information before your event, or they even help to come up with flyers or things like that. And I know we didn't have Roland colon, but we had the miniature version, Nolan the colon. But it was but it was information that was useful and helpful for people who didn't know about colorectal cancer, the screenings or the education part of it. So and I believe at both of these events, I think it was and Gina and the staff, did the pre-screening questions. And I know we always seemed like what always worked for us was always having some kind of
I'm on a webinar. Tell them as soon as I'm done.
Like a snack or a lunch. And but and the second thing is like some of the successes that I'll just state is that with this grant we have, by having individuals going get their screening, it helped IHS meet their GPRO goal this past 2 years. And it's also always good to buy some kind, like I said earlier, like some kind of food or door prizes, because that kind of gets people to come in, to attend your events. And then people who do inquire, and they do meet the criteria of the grant, they're pretty happy to receive their gift cards, when they come back and they complete their screening kit and they turn it back into lab. And another success that was really, and like I said, I'll just piggyback what was said earlier. We have great staff at our Indian Health Service, like our PHNs, especially our lab department, our nursing department, because it seems like, like whenever you tell them, say, look, we're planning an event, you know, very rarely have I ever got a no, you know, from them. They're always willing to come down. And of course, you know, we always plan it. So if it is something in their schedule that, you know, that might be a hindrance, you know, we always work around it. So, but it's that collaboration and communication and cooperation. I think that's what helps make this grant successful here too. Like you said, you know, and then they bring the kits to the events too. You can take them home and they get education on it there. But some of the challenges, you know, we don't have a lot, but you know, one is like our transportation. You know, for people, you know, once we get these in to get screened. So what we did is, you know, we talked with our CJR department, you know, and they're willing to, you know, pick up patients and their kits, you know, and you know, to bring them in and to make sure they get turned in and they get their gift cards and I don't know, maybe if this would be a challenge, but you know, like through these education events, you know, with some individuals, it was just getting them to understand the importance of getting a colorectal cancer screening, you know, every, or just to, you know, some of them didn't know, you know, that they needed to be done, you know, and so because of the cooperation and the collaboration, you know, we're able to get that out. And so, remember, like some of the success and challenges that we have. So, you know, to kind of like, you know, to sum it up, you know, it's just the cooperation and, you know, and the communication with the IHS and our resources here, and just the communication with the Tribal Chairman's Health Board, you know, with Gina and, you know, Devereaux and Tinka too, Chad, you know, whoever, you know, I call, you know, we always get good feedback, whether it's an email or a phone call. And so March, correct, is March colorectal cancer screening month?
Yes, it is.
Okay, so that's something I know, you know, I some you know, some different, you know, tribes, different entities, you know, where they have their, you know, like some of their employees participate in activity. So that's something I want to try here, you know. And Gina, was that last year that one of those tribes, they were like little Smurfs?
I think it was last year, yeah.
Okay.
For the Show Your campaign.
So that's just some of the stuff, you know, here, you know, and like I said, I know out of the 4 years, you know, this is our third year of the grant, you know, so as far as, you know, we're concerned, our office, you know, we're really, you know, thankful, you know, for the opportunity to have this, because it does, you know, it helps to get the education out there, but let people know, you know, the importance of, you know, getting a screening, and they have questions. So, and that's what makes this grant easier, and it makes it, you know, it just makes it easier to facilitate when you have, you know, good people to work with. So, well, with that, I think that's what I have to share.
And one other thing I wanted to add to that, Richard, was the meal that was provided was actually donated through the health education program, and Richard makes a mean chili. It was very tasty, so thank you for that again. It was one of the best chili feeds I've ever had.
Great, thank you.
It was a lot of fun. Looking forward to coming back. And does anybody have any questions for Richard before he ends his presentation? No? All right, well, I'm gonna go ahead and say thank you, Richard and Jessica, for presenting today. We greatly appreciate all the work that you do in making this project a success. And, you know, the power of collaboration and communication is very important for anything. So, and everything. So once again, thank you for sharing your successes and your challenges with everybody today. And with that being said, I'm going to go ahead and turn it over to the Great Plains Colorectal Cancer Screening Initiative Manager, Todd Ready. He's got some slides to share with you guys.
Thank you, Gina. And thank you, Richard and Jessica, for agreeing to do those presentations. We really appreciate it. And having other knowledge to share on how to have successful events is always important. So we have here is our aggregated colorectal cancer screening rates by IHS in North Dakota, South Dakota, and Iowa, Nebraska. Eugene Gallego and myself worked on these charts to show the progress that we've had over the years that we've had this grant, to show how the screening rates, have gone up, and how we've been successful in implementing these subawards and increasing our screening rates. So this first chart that we have is for North Dakota, and obviously the goal of our cooperative agreement is to increase the rates of CRC screenings within our tribal communities. North Dakota aggregated data shown here represents the 5 tribal clinics in North Dakota. And the baseline aggregated data for 2015 was 22.8%. As you can see, that was the screening rate. And then in 2017, the screening rate went up to 29.8%. And as you can see in 2016, they had a 25.2% rate. And it's gone up, and that's because of all the hard work that they're doing in that state at all of those clinics. And since we have implemented the CRC grants and the subawards, we've seen an increase in screening rates ranging from 2% all the way up to 19% at the individual North Dakota clinics, which is pretty amazing. So, and each one of these charts that we have here, if you guys would like to use them in any presentations that you guys have, just reach out to us and just cite GPCCSI as the creator in them. And we also have information on those screening rates if you guys need that. So the next one that we have is for South Dakota. And as you can see, the baseline was 32.7. In 2016, it was 38.2. And then in 2017, it was 37.6. With these charts, the green one obviously is the IHS clinics, and then the orange one is the IHS goal that we have. So since the implementation, again, we saw rates increasing from 2.6% to 21.5% in individual South Dakota clinics. And again, that's just, all the hard work that they're doing, and it's fantastic to see that progress. Then our final one is Nebraska and Iowa. So we combine these two because Iowa just has the Meskwaki tribe there, and because it's aggregated, we want it to stay random. So as you can see here, this represents the 6 tribal clinics, and in the baseline data, when we first started, it was 10.5%. And as you can see, it is in 2017 was 31.6%, and 2016 is 21.1%. So theirs has increased significantly, again, because of the hard work, and because of the subawards that we're doing in each one of these. And then the screening rates increased from 9.5% to 33.7% in those individual clinics. So again, these charts are just to show the progress that we've had since we received this grant. And we will update these charts once we receive quarter 4's, program year 4's numbers when we get them. So thank you. And I'll turn it back over to Gina. I think there's some questions till the end, but okay, ask them. Does anybody have any questions on the charts before we continue? Yeah. And if you think of any questions, sorry, go ahead.
Dad?
Yeah.
So how does this compare to IHS overall? Do you know?
So if we go back to, so the orange ones are that's their goal. So 38.7 and 40.2 are the goals that we're supposed to have in the Great Plains area, IHS. So as you can see, aggregated wise, we're getting closer to the goals that they set. And, every year we get closer, and individual clinics, because it's aggregated, we can't show that data. But, there's some individual clinics that have reached those goals across the Great Plains area. And, but like I said, because it's aggregated, we can't show the individual clinics, but we're getting closer as a whole within each state, which is wonderful.
Well, is it like 40%? I'm not in front of the screen. I'm
on
the phone, so. Yeah.
Yep. So like for Nebraska and Iowa, the goal for the Great Plains area in 2016 was 38.7. And then in 2017, it was 40.2. And Nebraska and Iowa our 2017 got to 31.6. And then in South Dakota, we got to 37.6. And in North Dakota, they got to 29.8.
Good.
Yep. So we are getting closer every year.
Okay, great. Thank you.
Yep. Does anybody else have any questions? No? All right. Well, I'll turn it back over to Gina.
All right. Thank you, Chad. All right. So as mentioned earlier, Colorectal Cancer Month is going to be approaching in March. Awareness months are days and weeks that are important because they allow people with certain health conditions, along with their loved ones, advocacy organizations, and support groups to rally around a common health cause. March is Colorectal Cancer Awareness Month, and with this, we're going to be doing our Dress in Blue, our Show Your Blue Great Plains campaign. We'll also be doing a media blitz mail out. So you can be expecting to be getting packages with updated fact sheets and brochures about colorectal cancer. We'll also be running screening ads throughout tribal radio stations and newspapers. Many of our tribal communities will also be hosting screening events throughout the month of March. If your clinic is interested in hosting a screening event, our team is happy to attend with the inflatable Roland the Colon or Nolan the Colon. Roland measures 10 by 14 feet, and Nolan the Colon is much smaller, and he fits really great in lobby spaces, and he measures at 5 by 8 feet. And to book the Roland Colon or Nolan, please complete the request form that we have available on our website, or we can also email it to you. And if you're thinking about hosting an event in March, I would really encourage you to look at your calendar and select a date, because our calendars can fill up. So we want to make sure that we're able to accommodate your event. Our team always looks forward to collaborating with our tribal communities to increase colorectal cancer screening awareness throughout the month of March. And so we look forward to being in your community. We're also going to be doing the Dress in Blue Day, and here at Great Plains Tribal Chairman's Health Board, and so we'll be doing a photo also. This is a photo from our Show Your Blue campaign last year with our staff outside our new beautiful building here in Rapid City. And like I said, if you're interested in participating this year in the Show Your Blue campaign, we greatly encourage you to do so. First, second, and third place winners all will receive a canvas printout of your group photo dressed in blue. And first place will also receive a trophy. Registration forms for this campaign will also be included in your media packages that will be mailed out to your clinic and facilities. And we can also email you that registration form if you need it. And so the requirements for the photo contest, you must have a clear resolution when emailing your photo. You want to have it saved as a JPEG file. We cannot accept panoramic or crop photos. All participants should have blue included in their attire, and each photo will need to include a sign or banner indicating your clinic or community. And we will also need everybody in the photo to sign a media release and consent form so we can share that photo. This photo here, like I said, was taken last month in March, or last March, and we had a lot of fun with it. Our team, some of our staff did a Zuppa cook-off, and Eugene Gallego won that cook-off, so he's really proud of that. He's fist pumping over here. We had blue cupcakes, we had blue punch, and by doing this, it was a great way to bring our employees together and to highlight the importance of colorectal cancer screening. And it was a lot of fun. So I encourage you to, if you haven't tried it, try it this year. And if you need any tips or advice from us, we're happy to help you with that for your planning your Blue Day event. So we're also going to be sending out proclamations and encouraging our tribal communities to get a proclamation noting that March is National Colorectal Cancer Awareness Month. And by doing so, you know, it helps to raise the community's awareness of the importance of screening. This is an example of our tribal proclamation that was signed by the tribal president, Robert Feinhock of the Yankton Sioux tribe. And this document was also featured in their tribal newspaper and their newsletters. So it got a lot of views throughout the community also. So like we're encouraging you to, you know, talk to your chairmen, your chairwomen if you have them, and promote this. And with that being said, we're also pleased to announce that Dr. Drago Brooks with the American Cancer Society will be gracing us with a presentation on March 13th at 10 a.m. Mountain Standard Time. I will be sending a flyer out regarding that very soon here. He will be happy to join us, and he's a very busy man, so we're very happy that he was able to make time in his schedule to present to us. And we have some partner updates for you. Our partners at the North Dakota Colorectal Cancer Roundtable will be doing their achievement awards, and they are currently accepting nominations for Champion of the Year. And this award recognizes an individual who has dedicated their time and their talent to advancing colorectal cancer. They also have an Organization of the Year nomination and an Innovators Award. And that is for an organization that has tested a new idea for colorectal cancer screening improvement. And there's also a Community of the Year too that I guess I didn't include on, oh, it's there, I'm sorry. The Community of the Year too is also, so they've got four categories this year. So if you are in the state of North Dakota and you know, have a great champion organization, if you're doing something new for colorectal cancer screening, please go to their website and fill out their nomination form. Our partners with the South Dakota Cancer Coalition are also going to be doing achievement awards for colorectal cancer, and they have 3 categories for that, and that's going to include Champion of the Year, Organization of the Year, and also an Innovators Award. So we're happy to share that with you all. So once again, please submit your nominations and participate with their campaign as well. Some more partner updates include the National Indian Health Board. They are having a fellowship application open right now for the next generation of Indian health advocates. And they're going to be learning about the policies that affect the health of American Indian people. And it'll also help them to grow on their leadership skills and team building. And they will also be presenting at a national conference and contribute to the development of the national and tribal health programs and policies. So if you know any youth who are interested in that, please share that with them. It looks like the deadline for that is going to be March 30th, so there's still some time to apply for that. And another fellowship that's going to be offered through the National Indian Health Board is the Tribal Researchers Cancer Control Fellowship. And topics will include cancer epidemiology, cancer screening, cohort studies among American Indians, community-based chronic disease programs, cultural considerations in cancer epidemiology. They'll be also conducting focus groups, working on grant writing, and all American Indian youth are encouraged to apply. And application is it is available online. So we're please get the word out to any youth who have a passion for public health, and it would be a great opportunity for them. Some more partner updates. We have the the RISE, the Research Initiatives for Student Enhancement, and that provides opportunities for enhancement in public health leadership training to focus on the elimination of health disparities and promotion of health equity. And that is sponsored through the CDC, the University of South Dakota, and also the Kennedy Krieger Institute. So it looks like there's some great learning opportunities available for those who are interested. And with that, we'd like to carry on the tradition of life and remember that colorectal cancer is preventable, it's treatable, it's beatable. And, thank you once again, all of you, for all the great work that you do and your contributions and efforts that you invest into saving lives by promoting colorectal cancer screening in your communities. And if you have any questions, we are open to that. And does anybody have any questions or anything that they'd like to share? Sorry. Okay, you guys are unmuted. Sorry. You can. It was muted. I just hit the unmute button.
Oh, can you hear me?
Yeah, we can hear you.
Oh, perfect. This is Shannon with American Cancer Society, and just wanted to mention too that we know 2018 has come to a close, and the 80 by 18 campaign has been amazing, and now we are launching the 80% in every community campaign. So it really has that local level community focus, and still working towards that goal of 80% screen. So you'll get more information about that, I'm sure, from Dr. Brooks on that call too.
That's great. Thank you, Shannon. Yeah, we're really looking forward to that. So
awesome.
Cool. All right. Does anybody else have any updates or information or questions for us?
No,
Gina?
just a question. Do you have a sample of that tribal proclamation somewhere? Is it on the website?
Yeah. Yes. Do you want us to email that to you?
That would be great. Yeah, this is Lillian.
Okay.
Gina?
Yes.
This is Jolene Kaplan calling.
Hi.
And, hi. And, could we have Donna Lundy Sinclair's name added to the list to be notified when we're going to have meetings?
Oh, okay. I thought she was included on there, but yeah, we'll be sure to double check our list and make sure she's included on there. I apologize if she's not.
Okay, because we're going to have our colorectal in March, and she was telling me this morning that we want the rolling colon to come down in March, if possible, to Belcourt.
Okay. Yeah, absolutely. You just need to go ahead and take a look at your calendar and kind of zone in on a date that you'd like, so we can get it booked, and then fill out the request form.
Okay.
Julie, this is Chad.
Yes.
So we have her email as a Yahoo, and I know Yahoo's been we've been going to their junk folder. It's been kicking back. Does she have another email address that we can email her at? Or?
We'll email it to you as soon as we get done with the call.
Okay, perfect.
She'll email it to you so we have the correct one.
All right, wonderful. Thank you.
Great.
Thanks, Jolene. Does anybody else have anything to share or any questions for us?
Well, I just want to share again. This is Jolene Kaplan. We went up to the casino for Senior Day, and we gave out the kits, and we got the gas cards to distribute to the ones that bring back their samples to the lab.
Oh, great.
Yes.
Well, that's good. Yeah, all right. Well, if you have any follow-up questions, please feel free to email me or call me. We will be getting in touch with all of our sub-awardees regarding CRC month and encouraging the proclamations. So with that being said, I guess we'll go ahead and end our webinar today. And once again, thank you all for joining. Have a great rest of your day and great new year. Thank you.
Thanks, Nika.
Thank you.
Bye.
Bye.
Thank you.
Thank you. Gee, that was like one of the biggest calls. That was a lot.